Namaskar, welcome to Dialogue with Divakars. I am Dr. Hema Divakar, the obstetrician and gynecologist from the Divakar Specialty Hospital at JP Nagar, Bengaluru. Let's talk about cervical cancer. Whenever we ask the patients, do you know what's a cervix? So one of our patients looked back and said, of course I know it because my uncle had cervical spondylitis and I know what it's all about. But dear friends, we are not talking about the cervix here. The cervix typically means a neck, and what we are addressing today is about the cervix, as in the neck of the uterus, or also called the mouth of the uterus. Why should you know about cervical cancer? Well, there are two reasons why you should know. Because it is fairly a common problem in the country, and cancer, as you know, is a life-threatening disease. There are 75,000 women dying every single year in this great country because of the diagnosis of an advanced cervical cancer. So, would it come to you? Yes, it can come to anybody. But then, the important information that we want to share is the availability of the cervical cancer vaccine or the HPV vaccine. Just as you would give your baby the polio drops or the polio vaccine to prevent polio, you could give your daughter the HPV vaccine or the cervical cancer vaccine to prevent the cervical cancer. So this is a great boon and a big breakthrough in the scientific world. The usual tests, which are called the screening tests for cancer cervix, that is, as a part and parcel of the early detection of the cancer, the mothers are usually asked to have a test called the pap smear or the colposcopy or the visual inspection of the cervix. What these tests typically do is they study the cells on the cervix, that is the lowermost part of the uterus, and if the cells are transforming into cancer, we can catch them at the precancerous stage. And the advantage of an early detection or diagnosis is the doctor will then advise you for a surgery which removes both your uterus, cervix and the lymph nodes in the neighborhood, and you can stay the rest of your life as well with as good a quality as any other women in the neighborhood. That's the importance of knowing more about cervical cancer, the early detection by pap smear and similar tests, and the availability of HPV vaccine, which is to be given from the age of 10 to 45 years. So, yet again, we urge you to ask your doctor for more information and avail of the advantage, and let not India be yet again one of the last countries to get rid of the burden of cervical cancer. Have the HPV vaccine, the 3 doses, as early as you could. So the knowledge or the information is the power that you have within you.